Hi, this is Trina Roofs, Penn State University student, and I'm going to be going over case studies, utilization in the classroom to enhance reflection and inquiry. We're going to discuss the use of case studies in teaching nursing and the dynamic way that they lead to formation in nursing students, and then turn these students into deep thinkers ready to apply their knowledge to patient care. So the reason for case studies, what are they? Why are we going to be using them? Case studies use real or created stories of interactions to highlight learned content and help students apply it to patient care. They provide a way to delve deeply into problems and challenges students to think more about just the simple tasks and management that they do as nurses. They begin to understand the importance of critical reasoning and methodically picking apart components of a problem or a situation. As we know, healthcare today is very complex, and situations that used to have very simple and straightforward management plans now require greater thought and introspection to ensure that nothing is being missed and that the patient's concern or questions are being met. So according to Billings and Halstead, these are just an in-depth analysis of real-life situations. We can apply theoretical knowledge. It does help the student to build on previous knowledge, connecting their learnings to the practice that they're now out there doing. And it enhances problem solving in students, makes them think a little bit differently or broadens their way of thinking, and is a very good way of having more peer interaction and faculty input, making people feel more connected with their learning. And then it also helps us kind of think about how we think about issues and whether our beliefs and our values are correct or if they're in line with what we've decided we want to go into, which is nursing. So the case study that I selected was on influenza and the flu vaccine. It is a scenario between a medically trained student and a lay person who work together in a grocery store. It starts out with coworkers talking about getting flu vaccines, with one being in nursing school and the other being a 30 years her senior and having worked in the grocery business this whole 30 years. The RN student has a lot of knowledge and appears to be finding that this knowledge is missing from her coworker. She really highlights that it brings up questions around how we communicate when patients that we care for have strongly held beliefs that aren't substantiated by science. How do we go about talking to them about what it is that we believe is the truth according to research and science? How do we clarify misinformation around the flu versus respiratory infections versus gastroenteritis? And this can create a good discussion around what the different signs and symptoms of each are while we're looking at the case study. It can incorporate appropriate treatment modalities. It can also open a very robust discussion about anti-vaxxer stances and how this viewpoint got such a strong foothold in this country, how we can work with anti-vax families, and how we can assure we don't isolate those with different viewpoints from us, but keep an open therapeutic relationship with them. As the educator and facility for the classroom discussion, it's important to ensure deep discussion around these issues, but also ensure that the students formulate their responses and interventions as nurses, as opposed to how they may deal with similar instances in their personal lives. It's also important for the educator to make sure that the students don't go too far down a rabbit hole with this topic, and then move into topics that are too far away from the misinformation around the flu and the flu immunization. It would be very easy to start going in depth around the MMR vaccine if they start talking about anti-vax beliefs and autism, things like that. So in reading through the case study, there were questions that were posed during this case study, and I wanted to share those. Some of them were around kind of the nuts and bolts. What are the symptoms of influenza? Why doesn't the flu shot protect against stomach flu? How do vaccines work? How do URIs become infectious? What's the process there? What happens if you decide to skip yearly influenza vaccines? Is that a safe thing to do? What is it about flu that makes us need a vaccine each and every year? What about the antibiotic issue that people will resort to saying, well, if I get sick, I'll just go get antibiotics. And then what are antibiotics supposed to be used for? So these questions can provide a very quick feedback in a classroom setting. It can help students identify areas they may have some faulty knowledge. However, it's important when presenting case studies that students learn more than just to answer questions like this. So these are some questions that I came up with to pose during the case study. So why would the coworker who's been in the grocery industry for 30 years have vastly different information on the flu and vaccination than the student does? What other issues might arise in regards to healthcare with this age gap? With their age range, is there a better or worse way to go about bringing up the correct information? If you were taking care of a patient 30 years older than you, how would you approach this discussion? What would you say to someone who believes they got stomach flu and or a UOR in spite of getting the flu vaccine? What if you were talking with patients from other cultures who may think illnesses come from angering spirits or because you sinned? How can you be respectful and still educate and treat them? And then finally, how would you talk to this person about her worry of side effects, including, as she brought up, allergies, seizures, and autism? And if your tactic wasn't working, how could you change it? Where else could you utilize these types of skills, these different tactics that you're going to employ? So the reason I bring these up is because case studies can be most powerful when they utilize open-ended questioning. These types of questions require that students reflect on their knowledge and skills and come up with a deeper understanding and response. With this type of case study, the students can make mistakes in their delivery without worrying about offending the person they were trying to educate. So in this instance, it's somebody who's going to be senior to them. How can they talk with somebody in this age difference without offending them and coming across like, the youngster that knows it all? The classroom environment will give them the opportunity to try out different responses and techniques without being on the spot in patient care. Many of these questions don't have a single correct answer, but can open up dialogue with the students to help them understand their own biases and also consider what their own personal nursing practice will look like. So ultimately, this rehearsal and reflection builds a sense of salience for nursing students. By asking more open-ended questions, the students also learn from each other and hear the point of view of others in their class or groups to build a more complete picture. So it's everything that we're asking to get from a case study. I hope you liked it. For my references, utilized Benner for a couple of the resources, and then Bennett is the one who wrote the case study itself, and then our Billings textbook. So any questions, please reach out to me, and I thank you for your time.